Hi, my name is Jordan Moncrief, and I'm a third-year family medicine resident at the University of Nebraska Medical Center's Rural Training Track in Kearney, Nebraska. Today, we're going to show you around our clinic, our hospital, and a little bit of our city, so you get a better idea of what life's like here in Kearney. We'll do a walkthrough of our clinic building. Obviously, this is our reception area. We'll go first into our acute side. Our clinic has a walk-in urgent care style clinic where anybody can walk in and be seen at any time, call, make appointments, and can get a same-day appointment. So this is our acute care side of the clinic, and this is where people can be seen at any time. This clinic is staffed by physician's assistants and nurse practitioners, and they are staffed by the on-call physician for the day. We as residents are not actually scheduled in the acute care side. We have our own clinic schedules where we see continuity patients, but we can come over here and pick up acute care patients at any time to help fill our schedules, which makes it really easy to meet our ACGME patient requirements. Our acute care clinic also allows us the opportunity to do a lot of in-clinic procedures, including orthopedic management, minor skin procedures, laceration repairs, even gynecologic procedures, as well as vasectomies on the chronic side. As far as other procedures that we're able to do, we have a large range of flexibility in our program structure, which allows you to gain experience in a lot of different procedures, whether that's advanced trauma with chest tubes, intubations, central line placements, or things like colonoscopies. The flexibility that you're allowed to be able to tailor your training to what you want to do when you get out into practice is a real strength of our program. One of the many benefits of our patient-centered medical home model is that we do have on-site lab and imaging, which I'll show you here. We do have the ability to do DEXAs, X-rays, as well as a wide variety of different lab. So patients can come in before their appointments, get things done, or if you see sick patients on the acute care side, you're able to do a broad workup while you see them. So now we're on what we call the chronic side of our clinic, which is made up of 4 different pods like this one. We have 9 different physician providers in our clinic that we as residents staff with while we are in clinic. Their teams are made up of 2 nurses, and so each of these pods houses 2 different physician teams. We as residents have our own dedicated nurse who helps us with scheduling, rooming patients, scheduling labs, imaging, tests, and referrals. And she works with us each time that we are in clinic. Of our 9 physician providers, 6 of those are graduates of the Rural Training Track, and our associate program director has been in his position for the last 23 years. So a brief little stop in our now temporary office. We do have a dedicated space for all the residents. Currently, it's being used as a triage area in the COVID pandemic, but we have been relocated, so we do have our own space. Part of the benefit, as I mentioned earlier, about the patient-centered medical home model of our clinic, we have a diabetes educator, we have a clinical psychologist, we have a wellness coordinator who specializes in coordination of advanced directives, helping with our high-risk OB patients, as well as providing any social work needs that our patients have. One of the newer things that we've started doing in our residency program is a POCUS, or point of care ultrasound curriculum, where we meet and we start to work on our skills using one of the butterfly units that we can plug into our phones, we can use on our patients in our regular clinics, and each other while we're trying to gain those skills. We also have a dedicated conference room in the clinic that we as residents are able to use for various different reasons. We have what we call Teaching Day, which is our educational program that happens at the Med Center in Omaha, but is broadcasted to all the rural training tracks. So we get together as residents and take part in that. We also use this space for a once weekly residency meeting. We come together as residents with our associate program director once a week. where we talk about various different things that could range from updates in evidence-based medicine, concerns about the program, or specific rotations that often get solved right then and there. And we even do some board prep to help prepare us for both the in-training exams as well as our family medicine boards. So as residents in our clinic, we're treated like junior partners. We are actively involved in clinical decision making as far as how the clinic runs. We're also able to see our own patients on our own schedules and be able to staff when we have issues or questions that arise, but we're not being micromanaged. We're able to take over the care of our patients and operate how we want to and not just how someone tells us to. This video hopefully provides you with a lot of information about our program, but if there's more that you want to know, we do have a website. The UNMC Family Medicine website can link you to our Kearney's Rural Training Track page, where you can find out information about our program and about our community. We're now at our sponsoring hospital, which is Good Samaritan Hospital here in Kearney, Nebraska. We're standing outside of the emergency room right now because it is undergoing a renovation, which should be done in 2021. We'll have a brand new ER. Our ER rotation is one of the best rotations that we do in all of residency here. Good Samaritan Hospital has a level 2 trauma center designation, and the hospital serves an area of about 350 to 400,000 people from northern Nebraska to northern Kansas. So we may be a smaller community, but we serve a very large area. So we see a large range of pathology in all of our rotations, but especially our ER rotation. We're now at the Family Birth Center at Good Samaritan Hospital, where we are actively involved in obstetrics and pediatrics. Here in Kearney, we deliver over 1,000 babies a year in the community between Good Samaritan Hospital and the other private hospital, which we also deliver at. Of those deliveries, up to a third are done by family medicine providers. We work with both those family medicine providers as well as obstetricians to help with vaginal deliveries and first assist C-sections. What makes our OB months one of the strongest rotations that we do here in Kearney is the people that we get to work with, from the nursing staff on the OB floors to the providers that we deliver with. A quick stop to one of the most important rooms in the entire hospital, the staff lounge, where we have access to food and drink, helps us along with our daily duties, but also a nice perk. Additionally, rotations that are always highly ranked by our residents include geriatrics, which involves monthly trips to a nursing home 30 miles north of town, sports medicine and orthopedics, and pediatrics, which involves both inpatient and outpatient care of pediatric patients. But without doubt, the highest ranked rotation that we do as residents here in Kearney is our inpatient service with the hospitalist team. The reasons why this is always so highly ranked is the complexity of patients that we see stemming back from our wide referral base, as well as the educators that we're staffed with in the hospitalist team. One of the unique parts about a community program like ours that's different than a big academic center is that all the providers that we work with are volunteer faculty. They have a passion for teaching and make our education their #1 priority. These are shots from Yanni Park, which is one of the many public spaces in Kearney that provides a rich quality of life outside of medicine. In addition to the many clinical benefits of our program, life outside of medicine is equally as important. Places like this offer things for you to do as an individual or as a family, with outdoor activities, parks, splash pads, water sports, and ways to enjoy your time outside of your clinical duties.